So I welcome everyone to the talk. I created a behavioral activation program called Occupational Therapy, Occupational Performance Activation. Most people know it in short as OTOPA. And at Green Tree, we have, it's a group of all OTs. There's about 11 of us who provide services in OT. And we see lots of people with chronic pain. And where these individuals come from and the sources of pain come from anything from very complex injuries such as motor vehicle accidents, workplace injuries, cancer, repetitive strain injuries. And as an OT, we're part of the process of helping the person return back to certain occupations. And in our case, we usually help them return back to work. So we look at, so chronic pain to an OT, our job is really to look at pain, chronic pain, and how to deal with that within a functional context. So and this is what and where OTOPA really comes in, is we look at the mental health aspect, how mental health is impacting their ability to deal with chronic pain, how cognition is related to how they're dealing with chronic pain, and whether they can, for example, a lawyer, can you problem solve and can you remember things in order to do your job and still manage your condition of chronic pain, and we help people to achieve that. So one thing I wanted to point out was that medical impairment doesn't always equal functional impairment. And so even a person with, let's say, a WOD injury, person A can look very different from person B. And the fact that we might need to spend 10 weeks with person A, but need to spend 20 weeks with person B really depends on the client's context factors, like their environments, the type of work that they do, and the extent of barriers that they're experiencing. Oh, technical difficulties. OTOPA is based on an occupational therapy model where we look at the person, we look at their environments that they need to function in, including their social environments, their home environments, their physical environments. And we also look at all the occupations they must do. So even though we work within the return to work context, we're also considering things like, is this a mother? This is a mother of two who needs to work full time. And how many things that she needs to juggle, and looking at all those roles, and also all the symptoms associated maybe with her experience of chronic pain. There may be anxiety, flashbacks, all those aspects, and helping her manage all those areas of dysfunction in a functional way. So again, I really want to emphasize the point that medical impairment doesn't equal functional impairment. So if a person's really having difficulty in their daily life, that's something that to recognize and to say, maybe we do need to involve an OT here to look at aspects of how they're dealing with chronic pain. And maybe this person really doesn't know what to do in terms of how to cope adequately. There's lots of information out there, but really it's the functional translation of what we do with that information that makes a person's adjustment to chronic disability or pain important. So the goal of OTOPA is really to identify the gap and address the gap between disability and function. So we see a variety of different people, as I said, anyone from breast cancer to long COVID to chronic pain to depression and anxiety. And we address chronic pain from a large lens. Mental health factors, and I think we've heard today even from Dr. Chen, that is a huge aspect of how a person deals with chronic pain. And understanding the person's pain within their context so they feel heard, and then creating a program that's tailored to their needs, tailored to their context, is really how effective, like in terms of the roots of how effective OTOPA is in addressing their barriers. The OTOPA program is a 10-week program, and we recommend it as a 10-week program in general, usually. But oftentimes, depending on the number of functional barriers that the client might have, on average, I think we're getting many more patients with more complex presentations, and it's taking us about 10 to 20 weeks to move them from an area of disability or perceived disability or not coping well to a point where they're actually able to return to work with the sustainable skills and strategies and plans, and they're able to return to work in a meaningful way. The first half of the program focuses a lot on psychosocial education. We assess their barriers, we assess their symptoms, we look at what are the barriers currently, and then we look at where they need to go. So the program is highly tailored. You see that the scope of what I've listed in bullet points seem very large. There might be an aspect of cognitive hardening or cognitive assessment that we might need to deal with because it's in relation to chronic pain. There also isn't, some people might be in more distress. They may need more focus on distress tolerance skills and learning to self-soothe and getting their anxiety and stress down so that they're ready for work and able to get into a space where they're more functional. So those are all areas that the OT in OTOPA really focuses on in determining what are the actual barriers and what are the necessary skills or recovery or remediation that we need to put in place to help this person achieve the goals that they need to achieve to lead a more functional life. So yeah, and there was even a sensory integration component involved. If let's say they're having flashbacks with chronic pain, and we need to help their nervous system come down so that they can move forward in a functional manner. Now, a lot of people don't realize this, but when you move a person from disability to ability, we also look at returning people to work. And when you're off work for a really long period of time, you're dealing with chronic pain, it's hard to make that functional translation from being off work and just dealing with your home to learning how to manage that disability or manage the pain effectively while going to work and working full time. So that's an aspect we help them address. We also look at how to deal with the social component and how to deal with your colleagues, how to explain and make that transition. And meanwhile, maintaining that integrity and personal integrity and help them build that confidence so they can make that transition and successfully to work. So we really focus on reintegration into life roles and learning to manage their home life as well as their work life. So our perspective in this is leading occupational engaged life and predictable routines and meaningful pursuits is important, and that all matters of dealing with chronic pain should be rooted in function. We have to remember that as a person dealing with chronic pain, there's lots of things to juggle, and involving an OT can help put that into perspective and also help the process. We can help grade that process in terms of, hey, let's deal with mental health first, or, oh no, I think that we really do need to deal with this chronic pain piece. They're exhibiting like a huge boom bust pattern. This person, when they're feeling good, they're gonna go, 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 and then they crash. And then they're like, oh, I can't do this. Or, you have that individual who's saying, I can't do this because every time I move my arm, it hurts. So I don't want to do it. Like, just to give you an example, I just worked with a lady who had breast cancer, and the surgery was 2 years ago, but she was in remission, but she can only lift her arm up to her shoulder level. And she was a cook. She was a line cook, but she was so deconditioned and she's so difficult for her to manage her chronic pain that she became very debilitated. And it took me 13 weeks to move her from inability to even do a plank to going back full time, raising her arm, recovering her range, getting her confidence back, but helping her make that transition and understanding what is good pain, what is not good pain, how am I going to manage this within my life and my responsibilities and be successful and be happy. So here are some of our OTOPA outcomes, and our focus is really looking at active chronic pain management within the client's culture and life. And we incorporate cognitive, mental health, and really that integrated piece to help pull things together for the client so that they can return to their life roles. We believe that resilience, and I think this is evident in the literature, that resilience, people are resilient, but we just have to help them realize that and recognize that and discover that. And that it's not just about coping when you have chronic pain, but you can cope with purpose. Our referral criteria, we ask that they're medically stable, which means no medication changes. But generally speaking, we have had very strong success, whether virtual or in person. And I just wanted to throw in just a small statistic, but out of our 5-year in our data, we determined 73% who were eligible for the program. And out of that 73.3%, 100% were successful to get back to work. So I'm just saying, one of the things I hope everyone keeps in mind is that let's treat chronic pain from a holistic standpoint. We can be very successful and help these people live a purposeful life. Thank you.